Hi, my name is Bill Croson, and I practice pain medicine here in Coos Bay, Oregon. People have a lot of questions about pain and pain medicine, and so in this video I will provide information and tools that can help people understand and manage their pain. First, I will talk about what pain is and how it can get out of control. Then I will talk about things that we can do that make our pain better or worse. I will briefly talk about opioids and why they are not a long-term solution. And I will summarize what we do for injection treatments. For more specific information about a condition and what can be done about it, patients can call for an appointment because a referral is not needed unless you are using VA insurance and rarely others. The first few minutes of this talk will be from the perspective of a pain nerd. But please bear with me as I think these things are important if you want to understand how some pain is good and some pain is bad and how you can control pain. For a long time, this picture represented our knowledge of pain as the brain interprets a signal from the body as something bad. But there is much more to it. We know that people with similar pathologies do not all experience pain, and that some people without an obvious pathology can experience severe pain. What we know about pain has changed, and we know that pain can change with time and experience for each individual. Your pain is your brain's interpretation of a perceived signal from the body. Plenty of research has been done to explain the physical, neurologic, and psychologic components of pain, but when presented individually, the importance of these components can get lost. I am hoping that by explaining and summarizing these concepts, they can be of greater value. I will offer suggestions for those who would be willing to do further reading. If the brain is interpreting this signal as pain, then we need to review what we know about the brain and how it affects pain. The brain changes too. Practicing and learning is like exercise for your brain. New nerves and connections can form and get bigger and more active, while unused nerves and connections tend to fade away. We can learn and develop new abilities by studying and practicing things that are important to us. And we can learn and develop stronger responses to signals from the body or from experiences if those experiences are repeated. This second type of learning is often not done on purpose or by conscious choice. We think of pain as a sensation that guides our behavior, but it doesn't always guide it in the right direction. When pain protects us from the fire or protects us from damage, then that is good. When pain prevents us from exercise or prevents us from normal healthy activities, even when those activities don't cause damage, then that is bad. When we assume that all pain equals damage, then our interpretation of the signal as pain can be harming us instead of protecting us. The brain can interpret the same signal as either a threat, as in pain, or as no big deal. Many things can affect how the brain interprets a signal, such as the nature of the stimulus causing the signal, whether it is a fire or a feather, and the nerves at the site of the stimulus, how many nerve endings are there to send the signal, and if there is inflammation of nerve fibers, which is important because that inflammation will make each nerve fiber send more signals. The nerves that carry the signal to the spine and then up the spinal cord to the brain are important, because if they have been busy carrying pain signals, then they may carry more frequent and stronger signals compared to the first time they fired, because even those nerve fibers can learn without our brain being aware of the process. The nerves in the brain likewise can become seemingly overactive with repetition. All of these as individual components or concepts have been known for years, and as research fills in more of the details, we begin to see that our job in managing our pain is to find a way to use this knowledge to better understand the signals so that our brain interprets the signals in a way that gives us some control of how we react to those signals. This book, from one of my favorite neurologists, describes case studies of people whose brains were weak in one way and compensated by being stronger in other ways, giving us a clue to the complexity of the brain and the way the brain can change and adapt. This book puts these concepts together in a way relevant to pain. Their website has stories and workbooks to help you understand this process and hopefully develop some control over the process. If pain is meant to warn us of damage, then what is it when we experience pain that is not associated with further damage? Is it a misunderstanding, an incorrect perception, or maybe a natural process? If damage has already been done, then pain can be associated with the healing process. And this initial damage can include surgery, trauma, and arthritis. As we discussed, chronic pain can begin as repeated signals or sensations from the body, interpreted by the brain as pain, which can lead to overactive nerves carrying those signals. And that can lead to the growth of more overactive nerves in the body and brain. We believe that these nerves can maintain the feeling of pain even when the source of the pain has gone. After damage has healed, the pain and the associated damage can be relived through memory of the experience, especially if those signals have not been replaced by new or normal experiences and interpretations. This leaves one afraid to exercise because of pain. Stress, bad mood, and depression can all affect how we interpret both safe and truly dangerous signals from the body, making them all seem bad and worse than they should be. Sleep deprivation can contribute to all of these possibilities and make everything hurt. In another book by Dr. Oliver Sacks, he describes the way and reasons the brain interprets signals, as well as the brain's interpretation of lack of signals, leading to perceptions that are untrue and usually unpleasant. In this book, he even describes conditions of pain and how to treat them. And in this book, there is a discussion of what is called referred pain, in which a chronically painful joint overloads a nerve root, causing the sensation of pain along the entire nerve root. If we identify a pain as being not associated with damage, then we have to find a way to change our response to that signal, reinterpreting the signal so that we can work with or through what we interpret as pain. And in order to do that safely, we may need a little more information about pain and about the brain. So what can cause pain? Well, damage, of course. But as has been discussed, damage doesn't always cause pain. And pain is not always a result of damage. A previous painful experience can be followed by a decreased pain threshold. The pain threshold is the level of sensation at which we react to protect ourselves, leading to avoidance and intolerance of activities, even though those activities may be beneficial. The decreased pain threshold is a result of the nerves in the body and in the brain having become practiced and more able to be involved in a future painful experience, as if they are exercising and growing stronger in a negative way. Over the years, this effect can accumulate, and it can take a great effort to reverse the process. False beliefs can lead to blaming your pain on a bulging disc or a bone spur, when in fact we all have them and most don't have any reason to hurt. If you're going to let an X-ray or MRI image or report of a normal finding slow you down, then you really shouldn't look at them. Body image can cause pain if you believe that a part of the body is damaged or fragile. This will change the way you use your body, often leading to bad posture, poor body mechanics, and limited range of motion, and often increasing the feeling of pain. Decreased activity will lead to a decrease in normal signals to the brain. Poor posture will lead to abnormal muscle and joint action. An unhealthy mental image can lead to an increase in inflammation and a decrease in circulation. Over time, the nerves involved in these bad signals become overactive, and they dominate the nerves involved in good signals. With this image in mind, I'm more likely to be inactive, to hurt. I'll probably call in sick to work. I might even apply for disability. But if I keep this image of my favorite superhero, the Tick, in mind, then I want to get up early. I can still run 7.5-minute miles and swim 3,000 yards in an hour, even though this is what I'm doing it with. Of course, if I stop doing this exercise, I will stiffen up fast and quickly become one of my patients. Now, a reasonable conclusion is that inflammation is the disease and pain is the result. Inflammation can be associated with many things. The normal healing process from both trauma and degeneration. If a joint has been inflamed for an extended period of time, then we will start to see arthritis in the joint. But even before then, it can be painful. Smoking leads to inflammation, which contributes to coronary artery disease and lung changes, which may be the most obvious changes, but it truly is a systemic disease with increased inflammation throughout the body. This includes smoking anything, so don't call it medical if you're smoking it. Poor diet, meaning the quality as well as the quantity of what we eat. We need fresh food, lots of fiber, minimal processing. Google what is called an anti-inflammatory diet, and you will find lots of information. And the OSU Extension Service has programs to help. Also consider that many of us have food allergies and intolerances, which can lead to increased inflammation. And this could be explored with an allergist or dietitian. Abdominal obesity, meaning the fat inside the belly wall, can increase mechanical strain from carrying excess weight, but that's not all. Research has shown that fat within the belly wall functions as a separate hormone-secreting organ, leading to increased inflammation, poor glucose tolerance, and a bad cholesterol balance. Infection and poor oral hygiene can contribute because bacteria flourishes in your mouth and on your gums. The thin skin in your mouth, called the oral mucosa, allows for a relatively easy passage of bacteria into the bloodstream. Regular flossing and brushing, as well as treating cavities, decreases the bacterial load and decreases inflammation. Chronic use of opioid pain meds leads to an increase in inflammatory cells and chemicals in the nervous system. And chronic use of opioids leads to the development of antibodies against the opioids, and this antibody response will increase inflammation. So what can we do about pain? Well, we have to treat the body and the mind. And so we have to address the issues that we just discussed. So decrease inflammation and allow the body to heal. In the short term, use ice and NSAIDs. When you watch a televised sporting event, you see frequent, widespread use of ice. Consider that professional sports should have the best medical care that money can buy, and they start with ice and they use it frequently. In the long term, consider the anti-inflammatory diet, weight loss, stop smoking, improve oral hygiene, and minimize the use of opioids. We need to heal the mind with cognitive behavioral therapy, meditation, counseling for mood and stress and depression. There are many resources available, and there are professionals who can help. Research has found that cognitive behavioral therapy is significantly more effective than opioids. And here are just a few available resources on the internet. I found this in a magazine. Our local hospital ran these classes and hopefully will again. Without sleep, nobody heals, and so we need to treat sleep disorders. Not only obstructive sleep apnea and restless leg syndrome, but we need to consider the effect of socially acceptable substances like alcohol, caffeine, marijuana, and nicotine on our sleep. Just because you are sleeping does not mean that you are sleeping well. Sleep medications and other substances that help you sleep may inhibit REM or restful sleep. Buy a home sleep monitor. Fitbit, Jawbone, ResMed, and Whoop Strap are examples. Keep a log of your behaviors which might affect your sleep, like food, medication, alcohol, and activity, and then compare that log to the results seen on your sleep monitor to see if your sleep improves or worsens as a result. As we get older, many of us develop obstruction or narrowing of our airway, which can lead to what is called sleep apnea. This is often found in people who snore or who can't fall asleep on their back. If this sounds like you, then ask your primary care provider for an overnight pulse ox monitor, which will allow for a test at home. If that is abnormal, then you should have a referral to a sleep specialist. It helps to know that your pain is not because of continued damage, so education is important. Knowing what is and isn't likely to be damaging or painful can help keep you from blaming normal degenerative changes. If in doubt, see us or your doctor. Work within reasonable limits by decreasing your range of motion or resistance until tolerable, and then you can gradually increase. I have to do this every day as part of my warm-up. Take breaks and give yourself time to recover. Having good sleep posture is important because you can do damage during sleep while you're supposed to be healing. Stretch before you go to bed, then keep your spine and joints in a neutral position. This may require creative pillowing and bracing. In neutral, your spine will have a little inward curve in the low back and in the neck, as well as a little outward curve in the mid-back. If you sag, then your back may wake you with pain, and you may be extra stiff in the morning. If you sleep on your side, then pressure on your shoulder or hips would be expected to hurt. And if your spine is required to curve to the side, then that may hurt as well. Your waking posture is just as important, so stand upright. Maintain a neutral position as described and don't slouch. Use good body mechanics when active. We all know what good posture looks like on someone else, and so consider that watching yourself in front of a mirror or a glass storefront can be very revealing. It may require training to restore and be able to maintain good posture. Pace yourself because you're not 20 anymore. You can't do what you used to, but you can still do a lot, so work smarter, not harder. Just as the nerves involved with pain can go stronger and more able to carry pain signals with repeated use, you can exercise your brain to strengthen nerves that suppress pain, and you can decondition nerves that increase pain. This book has a good description of the process, and it has exercises to help you. If you want to control pain, then you have to keep moving with smart exercise. There are many internet resources for this, and a physical therapist can help with this. Motion is lotion in many ways, both physical and mental. If you stop moving a joint, then it stops producing joint fluid, leading to more pain. And if the joint is inflamed, then it may begin to form scar tissue and become less mobile. If you stop moving a muscle, then it can get tight and painful, and as time goes by, you lose muscle tone and joint stability. There are theories that the muscle lining or fascia can collect inflammatory cells and chemicals, and that movement and massage can remove that buildup. Increased motion leads to increased circulation and then to healing and decreased pain. Increased motion leads to normal, healthy sensory signals to the brain, which can decrease and replace unhealthy signals and decrease pain. Exercise causes the body to release endorphins, which are your body's natural pain relievers. With no signals from a part of the body, the brain will make up signals, and made up signals are usually bad ones. For example, loss of hearing leads to tinnitus, loss of vision leads to the appearance of auras and strange colors and shapes, and loss of a limb can lead to phantom limb pain. So keep moving. Be prepared for pain to arise by using common sense and available remedies. Heat will increase circulation and relax muscles, but overuse can increase inflammation and damage the skin. Cold will decrease inflammation and slow nerve conduction. Massage can increase circulation and provide the brain with good sensory signals to replace the bad ones. Therapeutic ultrasound works kind of like massage. Electrical stimulation, like TENS and neuromuscular electrical stimulation, may trick the brain by replacing the old sensory signals interpreted as pain with new signals. Some frequencies of electrical stimulation can make it easier to recruit or contract your muscles, which is helpful if you have been avoiding the use of those muscles because of pain. Light therapy, magnets, pulsed electromagnetic field, Kalo patches, and biofeedback all seem to help some people, so try it, you might like it. The term altered state of consciousness has been used widely and at one time was championed for the use of hallucinogens. But we do many things to change our state of consciousness, like coffee in the morning, relaxation, meditation, a hot tub, music, exercise. Yoga and Tai Chi combine both mental and physical changes. When your normal state of consciousness is filled with pain, then a change from that state can give you a break from the pain. Some people benefit from services provided by professionals, including massage, chiropractic manipulation, acupuncture, and trigger point injections. Medications can help, but first try over-the-counter Tylenol and NSAIDs, and limit alcohol and drink plenty of water when using these. Muscle relaxers can help, and if they do, then that implies that muscle pain may be a part of your problem. And so you should benefit from massage, stretching, exercise, and relaxation. The muscle relaxing medications seem to help you sleep, but be aware that they can be addictive and they can inhibit deeper stages of sleep. Opioids can decrease pain and can be very effective for short-term use. But is it worth it for long-term use? The first pass effect means that they may never work as well as the first time you take it. But it's hard to forget that initial relief, and so we keep trying. Continued use leads to an increase in inflammation in the nervous system, and so increased pain everywhere, which often leads to requests for increased doses. Continued use leads to the immune system making antibodies against the opioids, decreasing their effectiveness and increasing inflammation. Chronic use and higher doses of opioids leaves us with fewer options for short-term treatment if we need surgery or if we end up in the emergency room with a painful condition. Chronic use also leads to pain outside of the initial pathology, and so patients using opioids are less likely to get good relief from other treatments. The social implications of opioid use are in the headlines these days, and this book has a great discussion of how the pharmaceutical companies can bend the truth and how we got to this current conflict. Smoking tobacco stimulates the opioid receptors and so can give an element of relief, but only briefly, which contributes to tobacco's addictive potential. Smoking leads to increased inflammation in sticky platelets, which leads to coronary artery disease and peripheral artery disease, as well as vasoconstriction, decreased circulation, and decreased oxygen supply, which by itself can be painful and can lead to further damage and decreased ability to heal. I realize that it can be a struggle for primary care providers to manage total health and to keep up with all the demands of government and insurance, leaving little time to evaluate pain complaints. Some providers feel that it is not unreasonable to respond to a patient complaint of pain that disrupts sleep or limits activities with a trial prescription for a low dose of opioid pain medication, along with appropriate warnings of risks. If an initial trial of medication does not provide adequate relief, then a more detailed evaluation and treatment plan should be performed before the prescription is refilled, so that pain and treatment with medication do not become chronic. And this evaluation is something that I can help with. Once the use of opioid pain medication has become chronic, then the initial cause of pain is often less of a problem than the side effects of the opioids. There are dietary supplements that can help. Omega-3s and turmeric are anti-inflammatory. SAMe is anti-inflammatory and has been shown to be equal to a daily Celebrex. Even with good understanding and control of our brain's response to signals from the body, some things will still hurt. If these pains stop you from pursuing healthy activities and cause you to compensate in an unhealthy way in spite of treatments described above, then you are much better off seeking treatment from a professional. These conditions include broken bones, torn tendons, and painful joints. Surgery can help to repair damaged tissues and replace or fuse a joint. Injections can provide temporary and sometimes long-term relief. Injections with X-ray guidance can accurately place anti-inflammatory steroid in a joint or on a nerve. Injections can be used to temporarily numb a joint or nerve, and this can aid with making a diagnosis, and it can break the cycle of chronic pain. Anti-inflammatory steroid, if placed on the affected nerve root within 6 weeks of a shingles outbreak, can lead to more rapid healing of the outbreak and a much lower chance of post-herpetic neuralgia. Radiofrequency ablation temporarily kills the nerves to a joint and can stop the pain in chronically painful joints. This is frequently performed for the facet joints of the spine, where pain causes changes in posture that take the pressure off the joints. But these changes in posture put more strain on adjacent joints, on discs, on muscles, tendons, and ligaments. Radiofrequency ablation can help with spine, hip, knee, shoulder, and hand pain, and can often provide years of relief. The use of platelet-rich plasma is becoming more common. The platelets contain growth factors, which the body tries to attract to the site of an injury. To make platelet-rich plasma, we draw the patient's blood and then spin it to separate the platelets from the rest. Then we can inject the platelets where they need to be. In this way, we are mechanically helping the natural healing process. The VA is the only insurance that covers platelet-rich plasma, and only for knees and elbows. So I will talk more about that in another video. Spinal cord stimulation is a very effective tool that involves implanting a battery and stimulating electrodes over nerves in order to decrease pain. It is FDA approved for failed spine surgery and more recently for diabetic peripheral neuropathy, but it is used widely for conditions that do not respond to other treatments. These treatments are very effective in spite of some studies to the contrary. We have to look closely at studies and ask who is funding them, who is doing the procedure, who is collecting the data. If the details of the procedure are not provided, then there's a good chance that it was not done right. There is no regulation of how these procedures are done, but there are good, solid, evidence-based guidelines provided by the Spine Intervention Society that should be followed by everyone. You can call to make an appointment with us if you are interested in more information about injections. Surgery or injections can help with one aspect of pain, but if other aspects are not working well, then pain will continue. There are some new and exciting medications and treatments being developed for pain, but for the most part they treat the result of the disease. All treatments have limited potential to treat those results once they have progressed to the point of chronic pain. All treatments will have greater potential for success if we have trained our bodies and brains as previously discussed. Training your body and your brain should be a part of the preparation for and recovery process from normal wear and tear, as well as from trauma or from surgery. Training can improve pain threshold, decrease pain memory, promoting tissue healing and restoring ability and replacing bad signals with good ones. And so we have a lot of ways to manage pain, both our own and our patients. Each person may respond differently and will need to explore the possibilities in order to find out what works for them. If self-management is not enough, then we have plenty of other options which I can help you explore. When you think about all of these options, you have to wonder why we have been so quick to treat with opioids. Knowing that opioid use has a tendency to become chronic and ineffective means that we should not be starting someone on opioids if we aren't prepared to guide them through the process of getting off of the opioids. If opioid medication is covered by insurance, then they should also provide coverage for healthier alternatives and for weaning and withdrawal from opioids. Given what we know about their side effects and problems for society, shouldn't we be trying these other things before we resign our patients to chronic opioids?